Hi guys, my name is Olivia Singer, and I will be presenting generalized anxiety disorder. I'm going to apologize in advance if I sniffle or clear my throat at any time during this presentation. Unfortunately, I have been very sick this entire month of April, but I will try and do my best for you guys. So I chose to do generalized anxiety disorder because I am one of the 40 million adults across the world that suffer from it. And generalized anxiety disorder is just a big ball of many different types of symptoms, types of anxiety, treatments, just everything. And the textbook describes anxiety as the vague sense of being in danger, having the same features, the same increases in breathing, muscular tension, perspiration, and so forth as fear. That was on page 101 from the textbook. Now, the difference between anxiety and fear is the presence of a real threat. So, when one feels fear, there's a real threat involved, like a lion chasing you, and you have to run for your life because you're scared of the lion killing you. However, anxiety, you have that same feeling, but there's no presence of a threat. Nothing is chasing you, nothing is trying to harm you. Your body just constantly feels as though something is trying to harm you. There are 5 main types of anxiety. There is generalized, social, phobias, obsessive compulsive, and panic. So, starting off with generalized, it's considered a free-floating anxiety. It's just a feeling of worry and dread that's always there. And the DSM-5 considers the symptoms of it being distress lasting 6 months or more with fatigue, edginess, poor concentration, irritability, muscle tension, sleep problems, uncontrollability, and ongoing worry about varying circumstances. Phobias are the fear of a specific item, activity, or situation. So arachnophobia is a very common one. The fear of spiders. It's just a phobia that people have of spiders because they're scary looking. They don't actually pose any real threat usually. Social anxiety disorder is described as severe, persistent, and irrational anxiety about social or performance situations in which they may face scrutiny by others and possibly feel embarrassed. And that is also from the textbook from page 120. Social anxiety can be in any social setting, whether it's in your own home and there's social people coming in, whether it's out in a mall and you're scared that people are looking at you, whether you have to do a presentation and you get anxious about people watching you. Those are types of social anxiety that are really common. Panic disorder develops when someone has a repetitive and unexpected panic attacks, just a series of panic attacks without any apparent reason. Their behavior will change due to these panic attacks, and they may be more worried, more concerned about why these attacks keep happening, and they will likely avoid situations that may cause panic attacks. This is unfortunate because people are just paranoid a lot about things that will give them panic attacks, and they hold themselves back from situations that may be fun, but they may get a panic attack from, such as large crowds. One may get a panic attack and feel overwhelmed during a large crowd, and so they stay away from those. But what if they really want to go to a concert? They just can't because they're too scared of their panic disorder. Obsessive compulsive disorder includes obsessions, compulsions, or both that take up persistent and significant amounts of time while causing both distress and impairment. So these can be like cleanliness, organization, just those types of things, routines. So say someone has to turn their doorknob 3 times before they open it. or else something bad will happen. Or someone has to organize their pantry perfectly in order, or else something bad will happen. It's just that constant fear of something bad will happen if I don't do this consistently and all the time. And they are just compulsed to do this and make their worrying go away. There are many different personal factors that contribute to anxiety. One of the most prevalent ones is jobs, occupations. The most common one currently is occupations in the healthcare system after the COVID-19 pandemic. So, an article from the PLOS ONE journal found that healthcare workers who reported a low perceived social support from significant others had a higher probability of GAD than those with a high amount of social support. That is from the results section in paragraph 11. So, people in the healthcare system have to go through a lot, and they experience many traumatic situations that they often don't get to talk about or get treated. So that can lead to a ton of anxiety symptoms that don't really get seen. And ever since the COVID-19 pandemic, the healthcare system has been a really stressful place to work. So many things have changed, and there are a lot of dangers in working in that field today. Another personal factor is worldviews. So, an article from Current Psychology Journal displays the findings of a study of the different worldviews of people with and without generalized anxiety disorder. So, people with GAD showed more pessimistic views and negative views. They began worrying faster and they scored lower on the presence of meaning. This creates the idea that they have less meaning in their lives and thus are more likely to search for meaning. And that is from pages 3,299 to 3,317. The different treatments for anxiety, there are a lot, but the main ones I'm going to talk about are cognitive behavioral therapy, physical exercise, emotion-focused treatment, and medications. So, cognitive behavioral therapy helps patients change their mindsets and adapt to new functional behaviors and reactions. So, it can help people change their mindsets from, if I don't do this, something terrible will happen, to, it's okay if I don't do this, nothing bad will happen to me. It's just that belief in your head, nothing terrible will happen. Or going out in social situations. No one is looking at you, no one is paying attention to you and judging you constantly. It's just all in your head. That is one of the most common treatments because it is the most effective. Another interesting thing that I found while researching for this presentation was that physical exercise paired with cognitive behavioral therapy can actually quite productive in reducing anxiety. So, an article that I found from the Biopsychosocial Medicine Journal explained that after treatment, participants in the study reported satisfaction with treatments, that they had changed quite much in a positive direction, and that other people had noticed this positive change. So frequent exercise along with cognitive behavioral therapy seems to decrease anxiety symptoms and make people seem more positive and joyful, not only in their own lives, but to the people around them. And I think that's pretty interesting. Emotion-focused treatment consists of 16 sessions, and an article from the Counseling and Psychotherapy Research website explained how emotion-based treatment is effective in treating generalized anxiety disorder through identifying, modifying, and working with one's emotions to prevent and handle their anxiety. So the first step in emotion-based treatment is to identify the underlying cause of someone's anxiety, whether it's distress, avoidance, or specific triggers. And then Secondly, the therapist will help the patient learn healthy coping mechanisms and self soothing things like assertive anger and understanding how their unmet needs have caused them grief in the past. And lastly, medications are a really effective treatment when used correctly. I am one who uses medications. I actually have to take 2 different ones twice a day. So the most common ones are selective serotonin reuptake inhibitors. We just call them SSRIs, and then serotonin norepinephrine reuptake inhibitors, which are SNRIs. Both of those are antidepressants that help with anxiety symptoms and boost one's dopamine. So their fears go down and their happiness goes up. So, most commonly in the US, cognitive behavioral therapy is paired with medications to treat people suffering from anxiety, which is like me. I do those. So, with all these types of different anxiety disorders, all the confusing treatments, types, symptoms, everything, it is a no-brainer as to why anxiety is the most common mental disorder across the world. Anxiety does not discriminate. It knows its victims' fears, and it can just latch on to anything and make someone afraid of anything. Even if there's no specific thing that brings unease, anxiety can still linger and impact the nervous system constantly, which takes a huge toll on one's body. It is the most common and perhaps the most dangerous mental disorder because if it is left untreated, anxiety disorders can lead to serious complications in every aspect of life. So, thank you for watching my presentation on generalized anxiety disorder. Bye!